The American College of Diabetology is a new organization focused on helping better train the primary care workforce and those who are passionate about diabetes to provide excellence in care for patients with diabetes.
The American College of Diabetology is a nonprofit organization whose goal is to help meet the needs of America for diabetologists. Diabetologists are people specially trained in diabetes. We help certify the diabetes fellowships, make sure that they're well run and they have every component you need for your training. And we also provide a board exam for diabetes fellows graduates and for people who can test in.
There are a number of diabetes fellowship programs around the United States. One of them is here at Touro University, California. This is a program that trains primary care clinicians in a one-year training program to do nothing but diabetes to help adults and children with all types of diabetes so they can go back into their practices and better help patients.
Our program is embedded in a primary care clinic itself. So we have primary care providers who refer patients to us, and we provide specialized consultation services in diabetes management. And our fellows not only are trained in diabetes management or providing advanced diabetes care, but we also provide training in population health. So our fellows are encouraged in community engagement and community outreach programs and advocacy.
I was able to participate in really great conferences. I was able to participate in board meetings, and I learned a lot about the way the organization is being run. I think that having done this fellowship will allow me to focus on the parts of healthcare that I love the most, which is providing excellent diabetes care, fostering self-efficacy with patients, and just offering them tools to be able to make their day-to-day lives with diabetes easier and more stress-free.
I think it's incredibly important for endocrinologists to partner with the American College of Diabetology. We're trying to educate as much as we can with the world leaders in various areas of diabetes. We know that diabetes is a very complicated condition and affects many different organ systems, and so there's no one person who's an expert in all areas. So what we try to do is put together educational programs for clinicians so that they can receive this information from experts and from the leaders in the field. So I think that this is building a network, building this community of experts, and then trying to make sure that everyone is accessible to people who need them.
Generally, people think of endocrinologists when they think of people who take care of diabetes, but there's many primary care doctors who do it and are skilled in it. And we provide a mechanism for those providers to get recognized. There is such a need for people who care for patients with diabetes, and there's not enough endocrinologists to care for everybody. And we're trying to fill that niche.
I think there are a lot of primary care physicians out there who might have this strong interest in diabetes, and I think if they do, this is a wonderful opportunity to develop their expertise and help their colleagues and their patients. And that's what I think is wonderful about the American College of Diabetology, because it's making that opportunity happen for people. And I really think this is the answer. I think if we can train people who have a strong interest, we're going to be able to close this gap, and we're going to be able to serve as resources in our communities.
The ACD has successfully launched the first ever board exam, and some of us are board certified now. So we got that much needed recognition and credentialing. And ACD has been working on many other projects to get a full recognition in the eyes of, the healthcare systems, peers, patients, as well as many other stakeholders.
Being a member of the American College of Diabetology has really opened a lot of doors and allowed me to network with like-minded physicians and experts in diabetes care. And we are able to get together and share best practices and cutting-edge treatments. Being diabetology board certified allows me also to open some doors that I would not have otherwise had open to me. For example, ordering specialty treatments that might only be restricted to specialists are now available because of my board certification.
So in the past 2 years, we have already doubled the number of diabetes fellowship programs and already had our board exam. We plan to continue to grow this to be all diabetes team members. And we want patients to know that they have a place where they can go, where they can count on excellence in diabetes care, and that they are able to seek those patients out in their communities where they have the need.